Well, hello, Facebook, and welcome to the Colorado Springs School of Massage Facebook Live session for today, Saturday, the 8th of August. As you can see, we're kind of pointing out at one of our diagrams, and we're kind of zooming in on the back because today's topic is back pain and some of the things that we would probably want to know about back pain before we started working on the back. So come on in here. Let me show you a couple of things. As we come in here, sometimes, that's more comfortable. Sometimes we'll wind up getting a lot of calls from people talking about back pain, and it's super important to understand how important the back is. I mean, it helps us sit up straight, it helps us stand up, it helps us to rotate. There's flexion, there's extension, there's flexion laterally, rotation in all kinds of different ways. So the back has got lots of functionality to it. And not only does it help us stand up and sit down, but guess what? It's a place to hang our arms on and our legs on. So if we want to do anything, we've got to have a nice strong back. So some of the complaints that we will hear from people, they'll say, oh, I threw out my back. And this is one of those situations where they've been out in the yard and they went to pick something up wrong, of course, and they hurt themselves, but they put it down. It's like, oh, wait a second. Whew, no, I didn't hurt myself. Well, the reality is that they did. They hurt themselves. They're probably 10% injured. The body is compensating. 90% of the body is going in there and doing as much work as they can. And then the next week, they're doing something out in the car and, they hurt themselves, but, not really, I'm fine. Now they're 20% injured, and they keep on adding these little micro injuries until finally they're running around 90% injured, and their body is compensating for it. And then guess what? They go to brush their teeth at the sink in the morning, and I don't know what I did wrong, Joe, but now I can't move. I threw my back out brushing my teeth. No, you didn't. That was the last straw. Your body has been compensating all along. So other things that we hear that we need to teach about is people will have difficulty taking a deep breath. And it comes kind of from the back, and there's parts of the back that can affect your breathing. And so if you get a rib situation, one of the intercostal muscles can be in spasm, and you'll know it. You'll know it when you go to take a deep breath when something like that is going on. Other things, wake up in the morning with a stiff back, low back pain, mid back pain. So let's look a little bit at some of the things that we're looking at. As you can see, there's a whole list of muscles there, and these are different levels. There's the superficial layers, there's the mid layers, and the deeper layers, and there's a lot that we need to consider when we're working on these muscles. It's not just a back rub, it's not just a shoulder rub. We need to consider how all of these muscles work together and how they work opposite, because these myotatic units need to be able to do both. Some of the muscles that we're looking at in there, the trapezius, there's three aspects to the trapezius, upper, middle, and lower. We've got the erector spinae, those two big bundles of muscles that go along the side of the spine. We've got rhomboids, we've got levator scapula, we've got quadratus lumborum, and there's all kinds of cool sounding muscles, and each and every one of them has a very unique malfunction that happens when those muscles go into spasm. So let's look at the rest of my list. Some of the techniques that we can use when we're working on all of these muscles, and let me put that away now that you've had a chance to really saturate your brain with muscle names and stuff. Now let's talk about some of the techniques that we can use. In the Swedish method, there's effleurage, there's petrissage, there's tapotement, there are friction, which are like cross fiber and circular cross fiber methods. All of these, you can start off light, and you can progressively get deeper, and you can start pinching, and you can start digging holes. All of these are necessary to prepare the area for the deeper techniques. Deeper techniques would include those deep glides. We can do compression type moves. We can do myofascial techniques. If you've never experienced myofascial, it's where it feels like we're pinching your skin, but really what we're doing is we're lifting the top layer, breaking it loose from the next layer until we've reached maximum stretch for the fascial connections, and then it starts to lift the second layer off of the third layer. So there's a very cool combination of methods that we can use to separate those fascial layers, which is where the adhesions come in. So when you wake up first thing in the morning and you're stiff, it's because all those fascial layers have gummed up together.
And I should tell you, Joe, somebody just joined all of us just now. His name is W. David Berglund.
Hey.
He says, "Go, Joe."
Heck yeah. Awesome, David. Thank you for the pat on the back. We love that. Some of the other things we do, passive stretching. If you've never had somebody take you and pick you up and kind of wring you like a dish rag, we do that sort of thing. And when we're doing that sort of thing, a lot of times we'll get a spontaneous cavitation, if you know what I mean. We'll get a little pop in the back. Many times, because we're not doing that to elicit a pop. We're not looking for a pop. We're looking to stretch the tissues. But when the tissues start to relax, anything that may have been out of place might pop back into place spontaneously. And so you get a freebie when we're doing stretches sometimes, but the goal is to return the normal resting length to that muscle instead of that muscle being tight and in spasm, creating pain and pinching nerves here and there. The compression type methods where we're pushing down, what our goal is to stop the blood supply to that muscle. Because if that muscle is in spasm and you take away its fuel, guess what? It stops spasming. Once it has stopped spasming, we can go back in there to soothe the tense soreness out of that muscle, and then we can move on to another area.
So, Joe, for potential Joe's Body Shop clients who maybe this morning they did something, they tweaked their back, right?
Sure.
Is there anything they can do before they come to see you next week in terms of just a little bit of maintenance?
Well, some self-care kind of things that you can do. If you do pull a muscle and you know that it's definitely a muscle that's pulled and it's in spasm, you can take a hand towel, not the little tiny ones, but the bigger ones. Take it, put it in the sink and run water as hot as you could stand it. Wring it out, but that moist heat from that towel, put it on that muscle, whether it's on your back, on your leg. Keep it on there for about 10 minutes and have a second towel ready. Get it nice and hot, wring it out, and then swap them out. Continue to swap in a fresh hot towel to keep that moist heat on those areas, and they will start to relax. And then once they're relaxed, you can start doing some range of motion. How far can you rotate? How far can you bend? Now, not to the point where you're going to re-injure, but you want to kind of test those areas that were sore, that were in spasm, get them to start lengthening. So by the time you come in for your massage, whether it be with one of our students or whether you go for a professional massage at Joe's Body Shop, either way, you are helping to make that therapist's job easier, and you'll get a better result when it's all done and said.
So, Joe, with that in mind, is that what you just mentioned? Is that a type of stretching? Is that what that is?
Range of motion and stretching, two different concepts. Range of motion is where, okay, I'm just going to move it around as far as it will go and make sure that it will comfortably move. Stretching now is where we're taking it to its maximum range of motion and we're exceeding it to lengthen the muscles that are associated with that stretch. And so we can go in there and we can stretch those muscles out on this side by pulling the hand this way, pulling it this way, stretching the muscles on the other side, and that's different than just range of motion. Hope that answers your question.
Very good. Thank you, Joe.
Awesome. So these are all different things that we need to, not only the methods that we're going to use, the techniques we're going to use, we have to also be aware of what muscles we're going to be targeting. We need to know, how do the muscles interact with each other? How do they work opposite of each other so that when we have a spasm muscle here, we know that its counterpart is going to need to be treated too on the other side of the body, either on the side or on the front or on the back, depending on where the bad muscle is. Depth and technique will need to be adjusted. If we're working on a client and you're doing a compression and it's creating more pain than they can tolerate, we need to recognize, oh, back off on that pressure. Or you know what, let's soothe that and we'll come back to it later once it's calmed down. Maybe approach it with stretches. Maybe approach it with glides. Use different methods and different techniques. So, any questions? Did we get anybody?
Well, let's see here. Well, somebody just jumped in. Not sure who that is, but one thing that I think a lot of people, if I can be so forward here, Joe,
Sure.
might want to know is how it would seem to me that having somebody that comes in regularly, is that going to help them maybe stave off hurting their back and learning more about what they should do and not do by coming to Joe's Body Shop?
Well, actually, coming to Joe's Body Shop is a great thing. But speaking for the school, to help educate you, self-care is super important. If you are going to chiropractic on a regular basis for maintenance, that's an awesome thing to do. It makes your body find what is normal for it, and then it will memorize that new normal. The same way with massage therapy. We teach our students that self-care is super important, especially for those people that are in the fields where you give, and you forget how to receive. And so we teach our students how to get a massage on a regular basis, or if they need to do yoga, or if they need to do some other form of body work. Any one of those things on a regular basis will help strengthen your body and teach it what is normal. Instead of this being your normal, we'll teach you that this is a nice, relaxed, comfortable new normal for your body. And that way, you'll stay in a healthier state of mind, a healthier state of body, and you won't need to go in to get fixed. You'll go in because it just feels good and you don't want to stop.
And you do have regular people who come in all the time for somewhat of a maintenance kind of schedule. Is that
Absolutely, right? Absolutely. As a matter of fact, our student clinic has a lot of people that are coming in, not to get fixed, but for the regular maintenance that they like. They come in every 2 weeks. Some come in as often as once a week. And when our student clinic opens up again in September, because all of our students are now graduating and the younger class is not quite ready yet, give them until September, and then we'll have a ton of appointments available, and you could enjoy a wonderful student massage for only $35. And I'll tell you what, these are amazing students. We get rave reviews for the massages that they do.
I know I was very surprised myself. One of your students is leaving, which I think is ridiculous. But anyway,
you can follow that student.
I guess she graduated. Is that it?
The term is she graduated, and if you're okay with paying her this student's professional rate, you should make a phone call, schedule your appointment, and follow them. We encourage our clients to do that.
And that says a lot about your students, Joe. It really does.
Yep. We're very proud of our students, and I like to think that we are actually training the rock stars of tomorrow. And that's a very true point. We've had several students come back to visit and tell us their success stories and how successful they're being. And I'll tell you what, it makes my heart swell just thinking about it. It's really cool.
Now, I think you've told me, Joe, that as far as Joe's Body Shop is concerned, you've had a lot of people after the shutdown was over that were eager to get back here.
Very true. And you know what? Ask me that question in about 10 minutes when we're into the Joe's Body Shop segment, because I've got stories to tell you about that.
That's very good.
It's really cool.
And you also have a Colorado Springs School of Massage individual who graduates going to be helping you out here as well. Is that right?
Yes, there are times. We're very lucky in that we can watch our students grow. We can watch them blossom. And the very, very best performers in each class are kind of a target for me to ask them to come work for us. So we do have a student who's going to be apprenticing with me. I think you're going to love Emmanuel when you start coming in. He's going to be part of our staff eventually, and he does great massages. You ought to come in while he's still an apprentice and get a discounted rate.
He has had a lot of great things to say about how he has been prepared for his new career.
That's awesome. That is awesome, because I think all of our students enjoy that. To a certain point, it's like we are readying them to go out and start their own business, and they're successful doing it.
And you're building toward fall right now, is that correct?
Correct. We are enrolling for the October class. We've got plenty of seats left. It's going to be a fantastic class. The people that we're right now talking to, wow, what an amazing bunch of people. You're going to love being part of that group. So if you're looking to become a massage therapist and haven't decided that you want to go to school or you haven't picked your school yet, give us a call. Let us give you a tour. Let us explain who we are, what we do, and how we do it. And I think you'll fall in love with us too and be one of our students. Alrighty, so if there are no other questions, I'm going to go ahead and wrap it up. We're going to go do some more studying on muscles and start preparing for some back work. So have a wonderful week, and we'll see you next weekend. Bye-bye.